Hi everyone, welcome to today's podcast. On today's Face Facts by Dr Yusra, I have Sophie and we are talking all things pregnancy and breastfeeding. We've discussed what you can do and what you absolutely must never do while you are pregnant or breastfeeding. Some things might surprise you. As always, please follow, subscribe, share, and I hope you enjoy. Welcome, Sophie, to today's podcast. On today's Face Facts, we are talking all things pregnancy. I have a lot to say about this one.
You do.
I think you've come with a lot of questions as well.
I have.
So let's talk about pregnancy and breastfeeding.
Okay. So my first question would be pregnancy and breastfeeding.
I thought you were going to say, what is pregnancy? But
no. I'm okay on that one.
Okay, let's go back. Go on.
What is the sort of main consideration that expectant mums, new mums should take when it comes to dermal fillers, anti-wrinkle treatment, skincare?
New mums and expectant mums.
Yes. We can break it down to expectant mums first. So pregnant mums.
During pregnancy, obviously, you have a developing fetus, and pregnancy, they say, is 9 months. To be honest, that's not true. It's 10 months. 40 weeks.
People can't count.
People can't count. Sometimes even longer, bless them. So 9-10 months of pregnancy, this is a time where you're growing this developing fetus. And there are things that you need to bear in mind, which is the things that you put on your skin can be absorbed systemically and can have an impact or effect on the baby, which can be a negative impact. Mm-hmm. And this is not just skincare. There's obviously diet. We know that there are certain things in your diet that you need to avoid while you're pregnant. Certain things that you should be eating before you become pregnant to reduce the risk of things like, for example, developing cleft lip and palate. Now, when it comes to aesthetic procedures, treatments, it's generally speaking a no. You can't have Botox, botulinum toxin type A, or dermal fillers of any sort, be that skin boosters or polynucleotides or Sculptra or Radiesse or hyaluronic acid during pregnancy and even whilst you are breastfeeding. Okay. And the reason why is because, to be honest, we just don't know enough. There's no data. There's no scientific evidence to tell us how it impacts a developing fetus. Mm-hmm. And therefore it would be unethical to pose potential risk to the baby. Now, what I do want to say is if you have had fillers or you have had botulinum toxin and then you become pregnant, that's absolutely fine. Mm-hmm. So there's no contraindication to having it before you fall pregnant. If you've had fillers or toxin and then you find out you've fallen pregnant, don't panic. Millions of women around the world have done that. And I will tell you, I pre-planned my toxin before I had my baby, knowing that I couldn't do it when I was pregnant or breastfeeding. Yeah. And though, of course, toxin's not going to last you 2 years or whatever if you're breastfeeding. It's a nice little perk beforehand. And so it's fine. It's fine to have it before you fall pregnant. Mm-hmm. It's fine to have it after you've finished breastfeeding. We can talk about breastfeeding and pregnancy because they are two different things and we need to talk about that. But during pregnancy, unfortunately, it's a no. Now, that doesn't mean you can't have anything done to look after yourself. There are things that we can do, but you can't have fillers or toxin just because the data doesn't tell us enough. Okay, yeah. And it's unethical to do tests on a pregnant or breastfeeding woman. I don't know many pregnant women who would put themselves at risk. Yeah. Now, let's talk about breastfeeding because there is a new research paper that has come out about the effects of botulinum toxin and breastfeeding. Mm-hmm. Now, botulinum toxin is a neuromodulator, which means it changes the way the nerves fire and send out a signal. So it blocks the release of a neurotransmitter called acetylcholine. So it stops that release from a nerve so that nerve can't tell the muscle to contract. That's how a neurotoxin works, for anti-wrinkle treatment. And it's obviously used in medicine as well for other things like, for example, spasticity. It can be used for anal fissures. It can be used for blepharospasm. Okay. But from a aesthetic point of view, the reason why we use it is to change the way that muscles are working. Mm-hmm. So we might want to stop the muscle from contracting to stop the overlying wrinkles, right? So that's how it's used. And when you inject it, it stops that nerve from sending that signal. And then after 3 months or so, actually after 6 weeks, that nerve starts to sprout out new nerve endings. And that's how it starts to send the signal again. Okay. So the peak of your toxin will be at 2 weeks. And then around week 6, the nerve starts to sprout out new nerve endings.
Yeah.
And then by 3 months, that nerve has enough new nerve endings to send out enough of the neurotransmitter to cause the muscle to pronounce and do its job or this function of contracting. The new research study that came out looked at how much of that botulinum toxin is absorbed systemically and is found in breast milk.
Okay.
And they found, and this was done on breastfeeding women, lactating women, who didn't breastfeed their kids after, so at the kind of the end of the cycle, or took a break from breastfeeding their children. And they found that botulinum toxin type A was found in breast milk.
Okay.
But they concluded that the amount found in breast milk is unlikely to cause a systemic effect on the baby.
Okay.
Now, there are 2 ways that one might interpret the study. You might look at the study and say, oh, great. It passes to the breast milk, we know that, but not so much that it's going to impact the fetus, because the dose to cause a lethal effect on a child is very high, or to cause a significant problem is high. But botulinum toxin is one of the most lethal drugs in the world in high doses. Now, in small doses, and the doses that we use in cosmetics is very, very, very small. But the plane in which botulinum toxin is transported in is the most secure plane, because high doses of botulinum toxin can cause fatality if it's injected in certain areas, like, for example, the lungs, and it stops you from breathing. So used by somebody who is a criminal to cause
Pain.
harm to a person, it can cause harm. Used in the way that we use, but this is true of anything, right? This is true of anything.
Yeah.
Used for medicine, and in the medicinal doses that we use, it is exceptionally unlikely to cause harm. So we use 50 to 100 units usually in one sitting, sometimes up to 200 units. Those are small amounts. Those are very, very small amounts. So they're not going to cause botulism. They're not going to, which is a toxicity. Okay. Because remember that botulinum toxin comes from a bacteria called Clostridium botulinum. And the story of how it was formed is a whole other podcast. It's really, really interesting, actually. But it can cause systemic effects. So in a baby, though we know that the amount of botulinum toxin being absorbed in the breast milk is unlikely to cause a lethal effect, in my opinion, and this is my opinion, not scientific data, in my opinion, it's not worth the risk.
Yeah.
So I personally chose not to have botulinum toxin while I was breastfeeding. Some people are using that data to say, hey, look, it's such small doses that we can treat patients with botulinum toxin. But here's the reality. This pregnant or lactating woman, she's pregnant for 9-10 months. It's a small period in your life. You're breastfeeding for, maybe up to 2 years. Sometimes some people breastfeed for longer. And if you are coming towards the end stages of your breastfeeding cycle, in the first 6 months, those women who are exclusively breastfeeding, the baby is fully reliant on their nutrition.
Yeah.
So they are growing only and solely through the mother's breast milk. And we know that breast is best. This is not a breastfeeding podcast. I personally breastfed 3 of my children, and exclusively breastfed 3 of my children. That was I acknowledge the privilege of doing that. When you are exclusively breastfeeding and your child has no other nutrition, note that means that if you're having botulinum toxin in that time period and it is passing to the baby, there's no studies to tell us if the amount that is going is therefore too much. So that's, I think, is a limitation of that study.
Yeah.
Is how much milk is that baby going to be drinking? If the baby is on foods, so they're eating now, right? And therefore the amount of milk that they're getting from their mother is much less, then there might be an argument to say, well, actually, the dose that the baby is getting, the amount that the baby is getting is so small that they can have botulinum toxin while they're breastfeeding. Okay. So it's a matter of debate. This is still a gray area. And here's a difficulty when it comes to aesthetic medicine and research. The data is always changing. This podcast is being filmed in August 2024. The data might change next year. Yeah. We might know more. But at this point in time, I feel that the data is not sufficient enough to reassure me that a baby is safe in a mother who is exclusively breastfeeding. Yeah. So my advice would be don't. I personally wouldn't if my patient was breastfeeding.
Yeah, we don't offer it at all in clinic for...
No. That might change. If the data changes, that might change. But for now, it's a no. Okay. Now, the second I stopped breastfeeding, I had Toxin. I put it on social media. I was ecstatic about it. Because look, I'm not going to diminish the impact that having a child has on you. It does age you. That's scientific fact. We know that when you are pregnant and after you've had a baby, you lose the malar fat pad and temple fat pad in the same way your body undergoes significant stress, in the same way as if you had went through a divorce or death and loss in the family, these significant life events can cause permanent lipoatrophy in the face, which is fat reduction. So you are going to look in the mirror and feel like, what the hell happened to me?
Yeah.
And I feel and look a little bit haggard and I've lost my mojo. That's normal. I felt that. And therefore, I totally want to create a safe space for women who are going through that to come in and unapologetically seek care. I am all for it. My mama friends out there. But I think there's a time and a place.
Yeah.
Yeah. And you're kind of like, you're in different eras in your life, and just that era, it's not safe to have botulinum toxin.
Yeah, definitely. And what about skincare during
You can totally use skincare while you're pregnant and breastfeeding, but your skincare is going to have to change.
Yeah.
So I'm a big fan of retinoids. Retinoids are a vitamin A derivative. We've talked about this. There's a whole podcast on vitamin A and retinol and the truth about retinoids. So go and listen to that. But while you are pregnant, you cannot use them. And the reason why is because when you put a vitamin A product on your skin, whether that is retinol, retinoic acid, retinol esters, retinol palmitate, there's a whole spectrum of different types of vitamin A ingredients you can use. And even in your diet, you need to significantly limit it. You should not be using any retinoid-containing products on your skin, whether that is the skin of the face or the skin of the body, because it is absorbed systemically and it is categorically been found to cause teratogenic effects on a developing fetus, which means deformities, permanent deformities to the baby. So don't just think that what I put on my skin can't be absorbed. It can be. You also can't take oral Roaccutane. This is really, really serious. So you must absolutely stop that. There is an alternative that you can use. And although there's limited data, the data has shown that there is promising rejuvenating impacts on photoaging, lines and wrinkles, and skin texture with a product called Bakuchiol, which is deemed a vitamin A derivative. It's not a retinoid, it's a plant-based product, and you can use that instead. So that's a pregnancy-safe ingredient. I wouldn't use it if I wasn't pregnant or breastfeeding. I think retinoids still stand as a superior product with decades worth of clinical data behind them. Bakuchiol lags far, far behind.
Yeah.
But we know it's plant-based and it's safe, so that's okay to use.
Okay.
The other thing that you absolutely can't use from a skincare ingredient is salicylic acid in high doses.
Okay.
So salicylic acid is again absorbed systemically. It comes from salicylate, which is aspirin. It's a great product found in numerous different ingredients used for patients who have acne in particular or oily skin. So it's a beta hydroxy acid. It's been shown to break down congested pores. It can decongest the skin. It has an anti-inflammatory impact on acne, but you cannot use it while you're pregnant in high doses. So we say less than 2% is fine. So if you're using it in a formulation like, for example, a toner, that's fine.
Okay.
But more than that, it's not. So any salicylic acid containing peels, no. But a once a day toner with less than 2% salicylic acid is fine. But I would discuss this with your prescribing practitioner.
Yeah.
Definitely, if you don't have somebody that to take care of you or to guide you, and you don't know the delivery system of the product you're using, please stop using salicylic acid, and retinols are an absolute no.
Okay.
What other ingredients? Benzoyl peroxide.
Okay.
Now, I'm an acne sufferer, as you know. This is a subject really dear to my heart.
Yeah.
I get pregnancy. I've had acne since the age of 16. It's my worst enemy. It's like me and acne are a constant fight. And I've never taken oral systemic products for it.
Okay.
It doesn't mean that that I don't believe in them. I do. I certainly have considered it, but I've had 3 children in the space of 7 years, and I've breastfed my children, so I haven't had space to do that. So I have relied on topicals, and certainly topicals can make a huge impact on acne. Now, acne in pregnancy is a real, I don't want to swear, but it's a real
Pain.
That's very well put. Diplomatically said. No swearing on the podcast. It's horrible. It's really soul destroying. But acne in pregnancy is very different to acne in teens.
Okay.
Acne in teens might be more pustular. You might have more of a proliferation of P. acnes bacteria within the pore. Whereas during pregnancy, you tend to get more hormonal acne.
Okay.
The hormones are kind of out of whack. So your skin might also be out of whack. Now, some people find that their acne gets much better during pregnancy. So there's 2 ways that this could go. And I found that for me, it was different in each pregnancy. There's no hard and fast rule, and you don't know who's going to get pregnancy acne and who won't. And what I would really hate is to say to my acne patients, stop using all acne treatments during pregnancy. You don't have to do that. Benzoyl peroxide is an ingredient that is fantastic at treating acne and is one of the first line treatments, skincare ingredients that you can get over the counter and you can get from your prescribing doctor. And it is an ingredient that is bactericidal, so it kills P. acnes bacteria.
Okay.
It also helps to exfoliate your skin and it helps to reduce inflammation on the skin. So it's fantastic, it helps to dry up sebum. And it works very quickly. Not all benzoyl peroxides are created the same. So the molecular weight and the size of the molecules differ in each product.
Okay.
My absolute favorite is therapeutic lotion, which is on prescription. It's very, very small weight benzoyl peroxide. And it works very quickly because it's so small, it really penetrates quickly and it works fantastic. So what we say is anything less than 5% is fine to use.
Okay.
Anything more than 5% is not fine to use. 2.5% is fine. In an ingredient where you're washing it off, like for example, Panoxyl, you can use products that are that have benzoyl peroxide that are used on the face that wash off.
Okay.
It's like benzoyl peroxide face wash. That's fantastic. You can totally keep using it. You can use it on your body, but keep it on your skin for about 1 minute before you wash it off, 1 to 2 minutes, because you want all that expensive active ingredient to be working on the skin. Fine to use. That's all the data so far, as of today's date. If the data changes, then we'll change our advice. But as of today's date, that is the advice. Benzoyl peroxide on the skin, when we put it on the skin, converts to something called benzoic acid, which you can actually get in food, and you get from food. Actually, you get vitamin A. Vitamin A is naturally found in the skin. It's people who are vitamin A deficient that end up with premature aging. People who are vitamin A deficient get an increase in enzymes that break down their skin. That's why we supplement with vitamin A or add vitamin A on the skin topically. So, although pregnancy, no vitamin A's, benzoyl peroxide, fine to use.
Okay.
Bakuchiol, fine to use. In limitation, right? So benzoyl peroxide, less than 5%, fine. 2.5%, no problem. Salicylic acid, less than 2%, fine. Sunscreen. Let's talk about sunscreen because pigmentation in pregnancy is pain. Sorry to interrupt the podcast. I am coming to you to say if you're enjoying this, then I would really love for you to like, subscribe, follow along, and share this with anyone who might find this useful. We are investing a lot of time, energy, and resources into bringing you the best of the best in education, all about faces, bodies, aesthetics, and wellness. And I want to continue to do that, but I need you to subscribe. And if you have any questions, if you want us to address any particular topics, then please leave a comment and we will certainly create videos for you to address those. Thank you, and I hope you enjoy. It's a real annoyance and a real concern for lots of patients. Melasma is well known to be really proliferates during pregnancy. We get an exacerbation of hormonal related pigmentation, chloasma and melasma in pregnancy and in breastfeeding. And sometimes it can come years after. We call that pregnancy mask. It tends to be like a butterfly on the cheeks, over the nose, and is symmetrical or bilateral. So it's very, very common and very upsetting, but it can be treated, it can be reduced.
Yeah.
During pregnancy, you cannot use hydroquinone. So no, you can't use it. Unfortunately, you're going to have to say goodbye to that. You can't use tranexamic acid, which is fantastic. It's a fantastic ingredient for pigmentation, but you can't use it while you're pregnant. It's not pregnancy safe, as we know so far. Okay. So hydroquinones absolutely have to stop, and they are systemically absorbed. But your number one best friend is going to be sunscreen. Yeah. Because the majority of pigmentation that you get is caused by UV exposure. When you're pregnant, my advice, my opinion, is to maybe limit chemical sunscreens. Again, this is a matter of huge debate. Okay. A lot of dermatologists will say it's absolutely fine to use chemical SPFs. I understand that. I acknowledge that and I can accept that. However, if there are safer ingredients, why not use them? Yeah, we know that zinc oxide is absolutely fine. Titanium oxide has also been deemed fine by the FDA. Zinc oxide in particular is an ingredient that you can get up to 20% and can block the sun's rays. It's a physical sunscreen. There is no debate about physical sunscreens in the same way there's no debate about clothes. Okay, clothes can block out the sun. So there's no debate about that. There is debate about the safety of octocrylene homosalate, and avobenzone, which are the 3 main ingredients found in chemical SPFs.
Okay.
And the issue there is that these particular chemical ingredients can be absorbed into the skin, into the bloodstream, and have an impact on the circulation on the body. So my personal opinion is if you're pregnant or if you're breastfeeding, don't use them. I wouldn't use them on my babies. So this is my opinion.
Okay. Thank you. Wow. I feel like I've had a full journey of everything to avoid and keep. I know with a lot of expecting mums, new mums, there are a lot of hormonal changes. What hormonal changes are there that sort of affect the face, the skin, the hair?
So your hormones are out of whack, right? So like your progesterone, your estrogen, you have an excess of androgens. Some people find that is fantastic for their skin. Some people find that actually it causes havoc. Who that's going to happen to, we don't know. But it is about your hormones and the increase in progesterone and estrogen. What happens is with hair, you get excess hair growth. So the hair that you may have otherwise been shedding, because all of us, hair has a skin cycle. We talk about a hair cycle, a life cycle of telogen, anagen, and catagen. And you can lose hair, you shed hair naturally, every human being. When you are pregnant, that hair shedding phase significantly reduces. So you retain a lot more of the hair that you might otherwise have lost.
Okay.
So your hair becomes thicker, it becomes more luscious, it becomes more shiny. It's amazing.
You sometimes get like the baby hair at the front. I know my sister had sort of a little fringe almost
that baby
appear.
hair, while she was pregnant or after?
Oh, maybe afterwards. And here at the sides, she's developed a lot.
Okay. So your sister recently had a baby as well. So what happens is when you give birth, approximately 3 months after, when your hormones start to level again, you get an increase in hair loss. We call that telogen effluvium. So you start to shed a lot of hair. And it's not that suddenly you're going to go bald, but you do shed the hair that you would have otherwise shed normally during that cycle. And so women, it can be really, really upsetting for women. Also, it can happen more if you're breastfeeding, you're low in nutrition, your baby's relying on your nutrition. So it's really important you're looking after yourself because you can't pour from an empty cup. And so a lot of women do start to lose a lot of hair during postpartum.
Okay.
And again, as I say, the psychological impact is huge. What then happens is when it stabilizes, which can take 9 to 12 months, they start to grow hair again and they get this baby hair. So I had that. Every pregnant woman will have it. They say, tell me you've had a baby without telling me you've had a baby. You see all these baby hairs coming. And that's normal. It's just part of the normal life cycle.
Yeah.
And it does tend to stabilize. But if it doesn't stabilize, then go and see someone because there are things that you can do that can help. There's a whole range of different things that you can do. And I would strongly encourage women who are going through hair loss, if they're finding that it's a lot and it's distressing, to seek treatment sooner rather than later, because the longer you leave it, the harder it is to rejuvenate that hair follicle and make it start giving new hair.
Yeah. What would you consider a lot? Because I know for people's interpretations of a lot is very different.
This is not, I can't give specific advice on the podcast about what is a lot. Because again, that's going to differ patient to patient.
Yeah.
It's normal when you're brushing your hair or if you're in the shower to see a lot of hair loss.
Yeah.
Okay. But if you start to get bald patches or significant hair thinning that is causing you distress, then go in and see someone. Okay. If after 12 months, actually, if after 9 months that hair loss hasn't started to stabilize and improve, I would see someone. Okay. But between the month of 3 and month 9, it's very natural. It's a normal process. It's unlikely that anybody will intervene and start treatment at that stage because your body is just shedding what it would otherwise have shed.
Okay.
If by a year you're coming in and you still got significant hair loss, I would be initiating treatment at that stage.
Okay.
There is something that you can do, which I would say, again, this is outside of the postpartum period. It's called the pull test. So you take approximately 50 hairs and you pull. And if more than 10% of the hair comes out, you get more than 10 hairs, then that's really concerning.
Okay.
So that's something that we also do.
That's postpartum.
That's postpartum. Yeah. So that's like a year postpartum.
Yeah.
During the postpartum period of month 3 onwards, we do expect that to be normal.
Yeah. I suppose we've covered now what we should avoid. What can we do whilst you're pregnant?
Okay, great. Well, your skincare routine, your non-negotiables in your skincare routine on a daily basis needs to be cleansing and wearing your sun protection, right? But there are ingredients that are fantastic during pregnancy that I would strongly recommend my patients to use. One of which is vitamin C. So vitamin C, unless you're acne prone, vitamin C is fantastic, particularly for patients who have pigmentation or drier skin. Vitamin C is an antioxidant that can strengthen your sun protection eightfold. It can also help to improve collagen production. It's clinically proven to help reduce age spots or pigmentation. So that's a yes. If you're acne prone and you don't like vitamin C, then consider niacinamide. Niacinamide is a vitamin B3. It's a water-soluble form of vitamin B3. And when you apply it on the skin, it helps to improve the barrier function of the skin and it helps to improve acne in 5%.
Okay.
So niacinamide is your best friend. So is vitamin C. You don't need both. You can use one or the other.
Okay.
If you want to use both, use them at a different time.
Okay.
Use your vitamin C in the morning. Use your niacinamide in the evening. Okay. Vitamin C, you can also add on. There are products where there's add-ons, like for example, vitamin E. Totally fine to use during pregnancy. Great for patients who, again, are drier and who have pigmentation maybe, and just their skin is really lacking radiance and hydration. I would not use vitamin E in acne prone or oily skin.
Okay.
You can use Floritin. So Floritin is an ingredient that comes from tree bark, the barks of tree.
Okay.
And it helps to reduce pigmentation. And you can get that as an add-on to your vitamin C. There's a really good product called SkinCeuticals Fluorescent CF. It's vitamin C with Floritin. That really helps with pigmentation. If you're acne prone, then no, use your niacinamide instead. You can use hyaluronic acid. You don't need 100 different forms of hyaluronic acid. You can have one cream with hyaluronic acid, ceramides, and hydrating elements in them. Find yourself a good moisturizer with all of those ingredients. Cholesterol is fine to use. You can get cholesterol in skincare. You can get fatty acids in skincare. You can get humectants in skincare, like glycerine. That's absolutely fine to use and really nourishing to the skin. Can you use exfoliants, so acids? The answer is yes, but you can't use all acids. So we talked about salicylic acid. Anything more than 2% is a no. Skin peels, it depends on what ingredient is being used. So you cannot use salicylic acid peels. You cannot use phenol peels. You cannot use TCA peels.
Okay.
You can use glycolic acid. So glycolic acid is an acid that comes from sugar. It's a sugar molecule. It comes from sugar cane. And it's an alpha hydroxy acid. It helps to break up the glue that holds dead skin cells together.
Okay.
So it reveals more radiant skin. You can use it in your face wash. Absolutely fine. You can use it in the evening. So you can use it in a skin peel. So there are skin peels that we do in clinic for pregnancy and for breastfeeding. Totally safe and fine to use. Even up to 18%, it's fine.
Okay.
Because it's not systemically absorbed. Polyhydroxy acids are fine as well. Gluconolactone or lactobionic acid. They are very gentle acids that can be used to improve the skin cycle.
Okay.
And to stimulate the skin and to exfoliate and reveal more radiant skin. Totally fine to use. Another best friend, this is a best friend during pregnancies, azelaic acid. You know how much I love this.
Yes.
I've used it throughout my pregnancies. It's probably the only thing that saved me, really, during my pregnancies. And azelaic acid can be used in 5, 10, 15, even 20% in pregnancy. It's totally pregnancy safe. It's been clinically proven to help with pigmentation, with acne, and with redness.
Okay.
And you can use it throughout pregnancy and breastfeeding. So that's your best friend.
Best friend. Keep azelaic acid then.
Keep your azelaic acid, absolutely. And then sun protection, of course, is a no-brainer. Is a must-have. My personal preference is mineral or physical sunscreens.
Yeah.
In clinic treatments, you want to talk about that?
Yeah, that was going to be my next question, but all right.
So in clinic treatments, what you can and can't do. You can't do, like I say, specific peels you can't do. You can't do fillers. You can't do radiesse. You can't do collagen stimulation. Anything like that is a no while you're pregnant. And the reason why is, again, we don't know. We don't have the scientific evidence. There is a concern regarding wound healing. You may have delayed wound healing during pregnancy. Also, stress and pain might be felt a little bit more due to the hormones. So if you're doing microneedling, your body is needed, the blood supply in the body and the nutrition is needed to look after your baby. The question mark around it is, should we be diverting attention away from the baby to skin rejuvenation treatments? The reality is we don't have evidence to suggest. In my personal opinion, I don't think it's going to cause much problems, but I wouldn't do it anyway.
No.
So it's a no. What you can do is there are things that we can do. We have pregnancy-safe facials. We have pregnancy-safe skin peels. You can use LED light. You can use LED light at home. LED light therapy has been clinically proven to improve collagen production, downregulate inflammation, enhance skin radiance. It can also be used to kill bacteria on the skin.
Okay.
So you can safely use LED blue light therapy for the skin. You can use red light therapy for the skin while you're pregnant. both in clinic and at home.
Okay.
There are certain facials that you can and can't do. You can do a hydrofacial as long as you skip out the peel. So we just change the whole protocol when we have a pregnancy safe facial. It's really important you understand that when you are pregnant, at a specific stage during your pregnancy, which is from week 20, definitely by week 28, you shouldn't be lying on your back because it can cause compression on your aorta and it's unsafe. So you need to be lying on the side, on your left side ideally. So during a facial, we may lie you on a side. But there are treatments that you can have. In terms of hair loss, you can have, or hair rejuvenation, again, you can have LED light therapy. You can have exfoliation of the scalp. But after pregnancy, you can have PRP.
Okay.
So there's no downside of having PRP. There's no evidence to suggest that PRP is unsafe during breastfeeding.
Oh, okay.
But I wouldn't do it while you were pregnant.
Okay. So going on from that, in terms of our more body contouring treatments with emerald laser, cool sculpting, M-Sculpt Neo,
Yes.
our M-Seller, which is slightly different.
Yeah.
Obviously not whilst you're pregnant because you are growing a baby, but whilst you're breastfeeding, are they safe to do?
Again, there isn't data to suggest if it's safe or unsafe. Generally speaking, we would say to a patient, don't use it while you're breastfeeding because we don't know. However, the M-Seller chair, for example, which is electromagnetic stimulation, high intensity focus electromagnetic stimulation to improve the pelvic floor that can cause essentially supramaximal contractions of the pelvic floor in a way that it's impossible to do yourself. It's impossible to do it. When you do your natural Kegels, which you and I could be doing right now, no one would know. These are when you're self-contracting your pelvic floor to tighten the pelvic floor. We suggest that all women do this.
Okay.
Whether you're pregnant or breastfeeding or not, people, it's important to keep that nice and strong. You are usually only stimulating 20% of your core muscles when you're doing that at home. With the M-Seller chair, which is a non-invasive, real life-changing treatment, you are doing this, you are essentially stimulating 100% of the muscle. That is totally safe while you're pregnant and breastfeeding. Oh, sorry, not pregnant. That's totally safe while you're breastfeeding, not while you're pregnant.
In terms of breastfeeding, and I know we've had this question before, if patients are just stopping for a week whilst they come in and have treatment, is that okay? Can they do that? Or do they have to have completely stopped?
This is up to your treating practitioner.
Yeah.
Again, there's no evidence to suggest yes or no. It's a conversation to have with your treating practitioner and the impact that might have on your lactation, also your commitment to stopping lactation. You might wish to stop. If you're far away from your child and you can't breastfeed, that's fine. You might want to pump and dump. That's okay. So yeah, that's a case-by-case discussion with a patient.
Yeah.
There are mummy makeovers that we do offer in clinic that can be had while you are breastfeeding, obviously not while you're pregnant. We might do some treatments for improving your core muscles. We might do treatments for, again, mummy makeover. We might do treatments for scar reduction in patients who have had a C-section. And I would recommend treating that as soon as possible, really, after pregnancy. As soon as the scar has healed, there are things that we can do like polynucleotides. That there's no evidence to suggest that there's any negative impact on a breastfeeding mother. Again, microneedling with exosomes from colostrum. I use exosomes from colostrum. There's no evidence to suggest that you can't while breastfeeding, but this is down to your practitioner and their comfort and your understanding of it. And it's important to understand that at the moment there's limited evidence about that. But there are treatments that we offer as mummy makeovers, postpartum, that are open to lactating women.
So just around this podcast stuff, I feel like I know everything now I need to know for when if and when I have a baby, what I can do and can't do. What are your 3 take-home points?
You can absolutely stick to a skincare regime, but stop all active ingredients until you speak to a physician. Retinols are an absolute no, so stop them immediately. Hydroquinones are an absolute no, so stop them immediately. If you've got acne, speak to your prescribing physician. You can keep your benzoyl peroxide less than 5%, your salicylic less than 2%, and your azelaic acid is your best friend. You don't have to stop that at any point, neither during breastfeeding or pregnancy or breastfeeding. SPF is your best friend. Don't stop that. In-clinic treatments, you can do some in-clinic treatments. You can have pregnancy-safe facials. You can have pregnancy-safe skin peels. But TCAs, salicylic, phenols are an absolute no. You can have glycolic acid without any problem. So you can continue with some exfoliants. You can continue with peptides, which have been shown to improve collagen production similar to retinoids. You can continue with plant-based derivatives like, for example, bakuchiol. But in terms of actual botulinum toxin and dermal fillers, I'd say skip that and enjoy the baby. Once you pop the baby, you're more than welcome to come. Once you pop the baby, if you want body contouring treatment, that's a conversation that we would need to have to ascertain what's going on and if we can help. I would generally say with body contouring, give your body grace.
Yeah.
You've just created a whole human being. It takes 9-10 months to make the baby. It takes at least a year for your body to start to feel back to normal. If you're pregnant, if you're breastfeeding, sometimes it is a bit longer. They do say breastfeeding helps to burn 500 calories a day. So if you can do it, do it. It's great. It's great for you. It's great for the baby. But if you can't or don't want to for whatever reason, still give yourself grace. Your body needs time for your hormones to reestablish and calm down. You don't need to jump back into looking like a model. Remember, strong over skinny. Just take time. Give yourself grace. And I think that's a real take-home message, because a lot of us put a lot of pressure and feel bad. I know that I used to as well, and you would say, stop it. But, that's it's normal, but you need to just talk to yourself kindly in the same way you would talk to a friend. When you are ready for an assessment, then of course you can come in, we can have a chat to you. But at least try to wait 6 months. Yeah. That changes if you've had a C-section. If you've had a C-section and you have a scar and you want scar reduction treatment, that is something that I would be happy to treat in the earlier months. Okay. But for body contouring in general, I'd say take time. The majority of the weight will go by a year. Anything left over from there, we can help you with.
Yeah. Well, thank you so much for sharing.
Thank you for coming.